welcome to Works podcast. My name is Pierre Clark. Today we're talking about loose skin. What are some of the issues with loose skin that we want to get rid of? What don't we like? Well, we don't like the image or what it portrays, and it gives a sense of old age. Even if you're super young, some of the causes of loose skin: pregnancy, rapid weight gain, hormonal changes that causes the skin's collagen not to be as youthful and strong as it used to be. Some of these factors can really deplete how we feel about ourselves. So in this episode, we're talking about the psychological effects of loose skin, predominantly on the abdomen. In our other episodes, we're going to go into some of the treatments that can be done for it. So keep watching. So first of all, this body image issues. Loose skin is going to change the way you feel about your body, right? Cody, when did you start getting loose skin on your abdomen?
I'm fortunate to not really have any.
You don't have any. Okay.
I have, that's where I gain weight.
That's where you gain weight.
So yeah, so it's like the opposite effect.
Opposite.
Yeah.
So over time, if you continue to gain a loose, you will start to develop loose skin on the abdomen.
Or, if and when I have children.
If and when you have children, that can happen as well. So loose skin on the abdomen, it's another thing is depression and anxiety. Where, when the patient comes to me and there's loose skin on the tummy, I can see the hesitation in my patient's face. I can see that this is something they do not want, but they also don't want surgery. Most of my patients do not want to replace the loose skin with a surgical scar. With that surgical scar, now you can't wear your bikini, you can't wear your shorts, you can't do a lot of things. So you're replacing one bad with another bad. So what are some of the options that can be done? We're going to talk about that. But look at the third issue here: social avoidance. With social avoidance, we tend to be inhibited. We wear larger clothing. We want to cover everything up. What are some of the areas of the loose skin that we see more commonly in the office is what we call this? The wings. The bat wings. So bat wings is very normal. Men don't really care about this, but this is something that affects women so much. Your spouse, your boyfriend, he loves you for who you are. He doesn't care about bat wings. Men generally don't have it because the makeup of the skin and the fat deposition on the female skin is different than men. So men don't develop that thickness and subsequently the looseness of skin behind the arms like women do. Also, the more muscular your arms are, the less likely you're going to have your back wings. So start hitting the gym, do your weights, tighten up those arms, and you will never have to worry about back wings again. So with this, we're looking at number 4, which is going to be the reduced physical activity that occurs because of the social avoidance and because of the body image issues. The less physical exertion you have, the more loose skin you can have because you're not tightening up your body. So everything tends to kind of work and feed off of one another. So let's look at some of the body issues that can occur on image number 1. So on image number 1, what are we looking at? Let's look at the belly button. How many belly buttons do you see that look like this?
A lot.
A lot.
Mm-hmm.
And many times patients ask me, I just want to remove this little lit looking thing over my belly button.
Yeah.
Right. The second issue we're seeing here is what? Stretch marks.
Mm-hmm.
So
you can almost see like a C-section scar at the bottom.
On the right side, stretch mark. So as this person's look at her hands also.
So her hands look a little bit older than her body, actually.
That's right, because the skin on the tummy typically will always stay a little bit firmer and a little smoother because it's not exposed to as much UV radiation. You don't wash the tummy as much either. And so the skin on the tummy always looks a little better. But in this image here, we can see that it's not really loose skin. It's really talking about the stretch marks. And when she pushed the sides in, it shows more of this loose skin. So this is not really loose skin to be treated. If she were to tone up her body, this would look much much better. Image number 2, we're going to go into some celebrities. We have Courtney Love. So I've seen many images of Courtney Love's body online, and almost all of them, well, most of them are always in a bikini. And there's some article that's always talking about the negative imagery of her tummy with the loose skin and the lines and so forth. How old is Courtney Love?
Gotta be in her 50s.
In your 50s.
Yeah.
So this is typical for someone in the 50s to have loose skin on the abdomen. You don't have to keep it, but it's very typical and normal. Image number 3, Emily Skye. Emily Skye is a workout diva. What is she? Who is she?
I like that. Yeah, it looks, I believe, please don't quote me, that she is a fitness instructor.
So as a fitness instructor, I'm assuming that in this pose, she's showing that even a tight fit body can have loose skin. And in this case, she's very, very correct. Because as she's tilting her shoulder down, you can see the looseness of the skin with the skin buckling here. This may look as, this would not be a surgical candidate, but this would definitely be a candidate to tighten up the skin using various devices that are typically used in many medical med spas. Image number 4, we're looking at Chantel Duncan after 3 kids.
She looks great.
She looks great. I mean, honestly, I don't see much loose skin here. If she were to appear in my office, I don't know if I can offer her too much with her skin because it really doesn't look that loose to me. She has a nice tan. You know, her features make me believe that she's in her mid-30s, late 30s. She's a beautiful girl, beautiful brown skin. I mean, she looks great.
I think she's older, but looks amazing for her age.
For her age, but I would definitely say
she's beautiful in general.
Yeah, I would definitely say that her demonstration of loose skin is on point because everyone will have some type of loose skin somewhere as time goes forward. Let's look at number 5, Tara Reid. Now, another image where you see Tara Reid's abdomen and the loose skin on her abdomen all the time. Okay.
She had lipo, and that's what it was. She had lipo, and it went wrong.
I see. Got it. So this may talk about the irregularity that she's having in the tummy area as well. So absolutely. Listen, guys, loose skin, especially on the abdomen, is very normal, it's very natural. What we don't like, or what most of my patients, what the females don't like, is the loose skin wide wearing bikinis or low cut pants or high cut blouses or shirts, or just wearing a bra. You don't like to see the skin. And sometimes if you find that you're covering your body up even at home, then there's an option for you to remove the loose skin or to treat that loose skin. That is coming up in our next episode. Hey guys, if you're enjoying these videos, take a look at my new book, The Lust for Medical Beauty. This has everything you need to know about the origins of facial beauty, where it can take you, and why we need so much more. So check out Amazon #1 bestseller. It's the only place you can get it now, The Lust for Medical Beauty.